All right. Dr. Khan is a very good friend of mine. He also has been played a pivotal role in my ideas as far as balance is concerned. He's opened my eyes to the need of balance, and today we have a great opportunity to learn about Dr. Khan and learn about his practices, and then you guys are going to get some valuable information out of this. First thing I'd like to do is just say thank you, Dr. Khan, for taking time out of your busy day to join us and share with us some information. So can you just tell us a little bit about yourself and what you do in your practice?
Yeah, sure, Chris. It's nice to see you. Yeah, I'm Dr. Obayduer Khan. I'm a board certified internist and also fellowship trained board certified geriatrician. I have been practicing in Naples since 2005. I have been involved in basically a lot of treatment of a lot of geriatric patients, including nursing home patients. I used to serve as a medical director for a nursing home. So in that sense, I have seen a lot of patients with falls, and I can share my experience with you. Yeah, sure.
Yeah, absolutely. So let's go nursing homes first. You said you're a medical director of a nursing home. How used to be, how prevalent are falls in that setting, in the nursing home setting? Is that something you see a lot of there in the nursing homes?
Sure. Yes, there are a lot of falls. This is one of the biggest problems in the nursing home settings, even in the community settings among our elderly patients.
So when someone falls in the nursing home, Dr. Khan, do you find that people are willing to tell you, or are most folks a little hesitant to let someone know, especially their physician, that they've fallen? And what risks come with a fall and someone not telling because maybe they're afraid of being moved somewhere or losing some independence of some sort?
Well, it's a different situations in nursing home setting because they are always under vigilance of the nurses because they always keep a close eye on the residents of the nursing home. So if somebody falls, they always find that out because they really cannot hide it basically. Unless somebody is very ambulatory and have fallen and forgot to tell about it. That can happen too. Like there are people who are demented and they may have fallen and forgot to tell about it. And they just forget about it.
Yeah, that's very true. That's I didn't think about that. And when that happens, Dr. Khan, when someone falls in the nursing home, what's the process there?
Well, when a person falls in the nursing home, they have specific protocols how they follow or what they do with that person. The nurses usually check that person initially to make sure they are not really injured. If they are injured and from an apparent assessment by the nurse, they usually call their physicians. Of course, they also check their vitals and see why they have fallen and try to assess the patient and find out if there is an acute emergency that they need to act on. So in that situation, they call 911, send the patient to hospital. On the other hand, if there are no apparent injury, they try to stabilize the patient and notify their primary attending physicians. In addition, the nursing homes also have protocol and try to figure out why that patient has fallen and what remedy they can offer. So it's a nursing home quality issue, how many falls they have that month. So they usually keep those, they track those. So this is a very quality indicator for the nursing homes.
So let's say you have a patient that you're seeing and they tell you that they've fallen in the last month or they've fallen in the last 6 months. What is your advice to them?
Well, I'm talking about in office setting right now. So what happens, like if a person come to my office, this may not be one of their complaints, but as a geriatrician, we are used to asking them whether they have fallen. If I find out that from that question that that person has fallen within a month or in the recent past and or have been falling multiple times, then definitely that's a red flag.
Okay.
Fall could be another signs of an underlying disease. And many times I've seen patients coming to my office just because they have fallen. They have fallen multiple times in one day. So that could indicate something else is going on. Not just the person's physical ability, it must be some acute medical condition going on. And many times we find that person is suffering from either pneumonia, urinary tract infection, or underlying infections going on. So that happens like in acute setting, like in acute conditions. Other times, fall could be from many other underlying problems.
Yeah.
From a person's physical ability to maintain balance or posture, or due to chronic weakness, due to lack of exercises or poor muscle strength.
Right.
Additionally, falls could be from taking many medications. Polypharmacy is very common.
Right.
And low blood pressure, because sometimes people can get up or stand up and their blood pressure drops, what we call it orthostatic hypotension.
Right.
This is very common, and they fall. There are other reasons, like a person could have lack of vitamin D in their system. So, studies have proven that, if somebody takes vitamin D, they're at less risk of falling. At least the risk of falling goes down by 25%.
I have a question on that one, the vitamin D. Do you find that there are some contraindications with some medications? Because, there's like with a diuretic that can pull potassium out of your body. With vitamin D, are there any indications that show that there's certain medications that could pull vitamin D out where you would need to supplement with more?
Not really, but
Okay.
but it is recommended that every person over age 65 takes 800 units of vitamin D every day, no matter what their status is. This is like a recommendation from American Geriatric Society. So the vitamin D has a proven benefit of preventing falls. So that is one of the many reasons people should take vitamin D.
Great information there, Dr. Khan. Let me jump back to when we were talking about the falls and the underlying issues. How often do you find when someone's falling, you've asked them that question, how often do you find it's a matter of underlying issues versus a lack of strength? Or maybe it's both.
Well, most often it is due to lack of strength.
Okay.
But because our elderly also have many underlying issues, we cannot ignore that, and we have to assess that and make sure that we are not missing the correctable problems.
Right.
So that's why, when a person comes to me and I find out that that person has been falling, initially I do an assessment, medical assessment. We check their vital signs, check their blood pressure lying and standing, make sure that blood pressure doesn't drop. If there is a
Right.
drop in blood pressure, there is a reason there. Of course, we find one reason that the person may have fallen because of the low blood pressure, because he got up, the
Right.
blood pressure dropped, and he fell because he felt dizzy.
Right.
Uh, in that situation, we adjust blood pressure medications.
Okay.
There could be other reasons for falls, like a person may be taking sleep aid, over-the-counter sleep aid, or even prescription sleep aids. Those
Oh, yeah.
reason for falls. There are many other medications that can cause falls. So we try to eliminate that. That is not the reason for falls. In addition, we do a physical examinations. Like we ask a person to get up from a chair without touching the handles. If that person cannot stand up, right there we can say, well, you do have poor muscle strength of your lower extremities, so that's why you could not get up.
Right.
We also check, like have the patient get up and walk 10 feet, and we see how fast he can walk. If the person cannot walk 10 feet within 10 seconds or so, and come back and sit down in the chair,
Right.
that person has a high risk of falling.
Okay.
This is how we assess. And
Right.
then if we eliminate the medical conditions,
Mhm.
and we can then point out, well, it's not the medical conditions, it's not the medicines, then it could be just simple lack of exercise, lack of strength in your lower extremities, or you have poor balance. In that situation, we refer them to physical therapy. After initial physical therapy, I tell them to continue on maintaining the whatever achievement physical therapy can give them.
Right.
So they have to maintain them, because physical therapy won't keep them forever. They probably
Right.
for about 8 weeks or so.
Right.
Because there is a limit on insurance how much
Right.
physical therapy they can get. But the thing is, I understand that the thing is when physical therapy bring them up here,
Right.
that's hold it right there, because they build their muscle strength and
Right.
give them good gait speed. But then that person has to continue at that level.
Right. And just to throw in there, it's about $1,800 per calendar year is what insurance allows for physical therapy. And so physical therapy does a great job, but the problem is most folks, they are discharged from physical therapy and they go back home to old habits. And so those folks that you see that do continue those exercises, Dr. Khan, do you see them living a more active lifestyle and reducing their falls?
Yeah, so if a person continue with a personal trainer afterwards, that certainly helps. That certainly reduce their chances of falling again, and that keeps them active, and of course, that reduces their fall. But the problem is many persons don't follow or continue on doing more exercise or maintain that level afterwards.
Right.
Because they may have received the physical therapy for a couple of months, and after that they again fall back to the level where they were 2 months ago, because they didn't continue on exercising or keeping their balance or strength.
When I do my lectures, and I tell folks there's 10,080 minutes in a week, and you only need 1% of that time to improve your balance. And I'd like to, Dr. Khan, and you can shed some light on this, when it comes to exercise recommendations, 10,080 minutes, that does break down into about 30 minutes 4 times a week and doing exercise. And now, what does the American Geriatrics Association, or what do you recommend, Dr. Khan, when it comes to exercise?
Well, so the exercise recommendation, what is coming from the national societies is that they should exercise at least 150 minutes of cardio exercise per week. They could do it in 2 days. That's okay. I mean,
Right.
it has to be 150 minutes. But
Right.
then another 2 days of muscle building exercise.
Oh,
So yeah, so at least 2 days, 2 days in a week, they should be doing stretching and muscle building exercises. So that is also recommended.
okay. So in addition to the 2 days of cardiovascular exercise, you have to do 2 days of muscle strengthening and building exercise. Is that correct?
Or they can do 5 days of cardio exercise,
Okay.
maybe 30 minutes, 30 minutes each day of
Okay.
cardio exercise. Or they could just do 30 minutes every day of the week. Like they can divide, like they can, they can put 30 minutes of exercise every day. Out of the 30 minutes, 5 days a week they do cardio exercise, and 2 days a week they do muscle strengthening
Strengthening.
exercise.
So I think the point here is that there's a lot of different ways to do it. It's just a matter of doing it. It's the biggest.
Yes, yeah.
So let me ask you this: when it comes to those that have fallen, how often do you see folks who have fallen and have serious injuries, acute injuries that need to be addressed?
Well, yeah, that's quite common.
Oh yeah,
Yes.
I was afraid of that. Yeah.
Yes. Yeah. Many people do fall and have their hip fractured,
Right.
or they get injury to the back, or fractures of other bones.
Right.
Many end up in the hospital with hip fractures, and of course, if somebody suffered from the hip fracture, that could be problematic, because many has to go into nursing home or suffer from post-operative complications such as pneumonia or even death.
And that's the last topic I wanted to touch on is the mortality rate after a significant fall. How often do you see someone who falls and maybe has a hip fracture, they have a total joint replacement or something like that after a fall, they go into a nursing home? How often, and this is not a very pretty topic to talk about, but of course it's necessary, how often do you see death occur in 2 to 5 years after that fall, or sooner?
Oh, actually, it's even sooner. Yeah, I believe the data is like almost 25% could die
Wow.
within 6 months. Yeah.
Wow, what a number.
Yeah, it could be. Yes. Yeah.
Wow. Well, Dr. Khan, I don't want to take up too much of your time. The information you have given us today has been golden. I greatly appreciate it. What I'd like to do is open it up to you, and if you would like to tell us the name of your practice and where you're located, please feel free to share, or how we can contact you, either through the website or maybe through social media.
Oh, sure. So I practice internal medicine geriatrics, but I do concierge medicine. My practice is located in downtown Naples. My practice name is Concierge Medical of Naples, or someone can search by my name.
Sure.
Yeah.
Well, there you got it. Concierge Medicine of Naples. Is that right, Dr. Khan?
Concierge Medical of Naples.
Yeah, Concierge Medical of Naples. Well, I greatly appreciate your time today. And man, this was great. We got a lot of great information, and I couldn't be happier with the way it turned out. So thank you.
You were most welcome, Chris. Nice to know you. I mean, you were my personal trainer, and I remember those days when I used to talk to you about doing something for our seniors. And you jumped on it.
Well, I'll tell you this, and this is a side note, and I didn't know if we would have time to talk about, but actually Dr. Khan was a client of mine, and just a quick story. Dr. Khan he's the kind that likes to get in and get his work done. I remember counting reps for you one time, and I think I started at 10 and I was 11, and I'll never forget, you turned and looked at me and said, "Stop counting and just tell me when I'm done." So, and I do remember you asking me if I would be willing to go into the homes and work with some of your patients. And of course, being the father of 4, I was absolutely willing. And you know, these kids got to eat and they have to go to college, and I have 3 there now. So we jumped on it, and I quickly saw the need of having someone post physical therapy, because, you know, there's a wheel there. You know, people fall, then they see their physician, maybe they go into the hospital, you know, and then they go to physical therapy, and then they're discharged and they go home. Well, I wanted to fill that spot between being discharged from physical therapy and another fall and hospital admission. So I work as a personal trainer, and that was upon your enlightenment and guidance that I was able to see that, and I am eternally grateful for that that direction, Dr. Khan, and your support for sure. Absolutely, couldn't do it without you.
Well, you know, this is a good service that you provide, because once they go home, they have nobody to do it for them. So this service is not available. Most often they can find somebody to come and help them out. So this is, nobody was willing to actually go to somebody else's house to provide personal training.
Right.
So this is a good service you are providing, and this is a much needed service. So this is great.
Thank you so much, Dr. Khan. I really appreciate it, and I enjoy it very much. I've become passionate about it, and I hope that we can make these resources available, you know, at little to no cost, you know, so that there's no excuse for a loved one or a caregiver to access this information and get it out to them. If I can't be there, somebody can, or you can't be there, they'll have this resource to rely on for sure. So.
That's wonderful. Thank you, Chris.
Thank you, Dr. Khan, very much. Always a pleasure, sir.
Always nice to see you.
You too.
Okay. Bye-bye.
Bye-bye.